A public health crisis in downtown Spokane. Around every corner, homelessness, crime, and open drug use are on display. What's harder to see, however, is the work happening between the city, county, and many other government and community organizations to solve the problem. From housing to policing to drug treatment, there are no shortages of opinions on this matter. So let's talk about the problems and the solutions. Next on At Issue, Can We Fix Downtown? Hello, and thank you for joining us for At Issue. I'm Dana Haynes. KSPS PBS is pleased to premiere this new public affairs program dedicated to in-depth reporting and important conversations about topics that impact you. Today, we are digging deeper into homelessness and public safety in our region, particularly in downtown Spokane. We have a large panel joining us today to talk more about the issues. Let's welcome Assistant Chief Steve Wool from the Spokane Police Department, Spokane City Council Member Paul Dillon, Spokane County Commissioner Amber Waldriff, Don Kinder, the Director of Neighborhood Housing and Human Services for the City of Spokane, Spokane City Council Member Jonathan Bingle, Joe Ader, CEO of Family Promise of Spokane, and Gavin Cooley, the Director of Strategic Initiatives at Spokane Business Association. Thank you all for joining us, and we do want to mention that we expected Spokane Mayor Lisa Brown to join us today, but she did decline at the last minute. All right, to get a sense of how the public feels about homelessness, housing, and public safety in Spokane, we want to share the results of a recent survey conducted by Greater Spokane Incorporated. For The Pulse, GSI polled 600 registered voters in the city and county. First, let's take a look at a snapshot of the top concerns. When asked, what are the issues facing Spokane that you are most frustrated or concerned about, 51% of voters overall and 59% in city limits cited homelessness as their top concern. 40% cited crime, drugs, and public safety as their top concern. 58% overall believe addressing homeless encampments would have a significant impact on the quality of life. And 52% overall said the same about property crime. Those numbers are a point higher for people living within city limits. And a whopping 93% of those polled agreed that downtown Spokane cannot fully recover until homelessness and public safety problems are addressed. All right, time now to get into our discussion, and we're going to start with Councilmember Paul Dillon. What's your reaction when you see numbers like that?
Yeah, I think it affirms obviously how a lot of folks are feeling in the city and county. I don't disagree with the top priorities. Those are very clearly outlined. I think some of the challenges, and I've said this before, there's some aspects of this that I do take with a grain of salt, from how many are inside the city or do come downtown. But you know, I don't want to minimize a lot of the challenges that we do face downtown and those feelings. At the same time, you know, unfortunately, I've seen surveys like this be weaponized in a way that I think can sometimes make the challenges bigger than they actually are downtown, which can cause a disinvesting, divestment from downtown. When we want people to come downtown, we want people to come to restaurants and to shop and enjoy downtown. We all want the same things. We want a clean and safe city. I know there's some disagreements with how they get there, how we get there, but the priorities there are very clearly outlined, and I do agree with them.
Okay, Commissioner, as a representative for Spokane County, the level of discontent is the same in the county. Did that surprise you at all to see those numbers?
No, I don't think it has surprised me, because everyone frequents many parts of our county. People live in the valley, they live north, they work downtown, or vice versa. So really, the Spokane region is a region, and we all can benefit from the positives, and we all are impacted by maybe some of the negatives. So I guess I wasn't surprised. I think your original data points were countywide. You know, what are the top issues that people think we need to address? And homelessness. Homelessness is an issue that's faced by people all over the county. And yes, it may be more visible downtown, but we know a lot of homelessness, especially family homelessness, is hidden. And it's folks doubled up, tripled up. It's impacting our youth. It's impacting our families. Our seniors are starting to struggle with the cost of housing. So really, it's a housing crisis countywide. And so I guess I'm not surprised that of the numbers of people who are concerned and want to see us as a region identifying ways to house people more quickly or keep people housed.
Okay, thank you. Joe, to you as a service provider, there's a, kind of that perception, oh, nothing's happening, which is why we're doing this show, because there's a lot happening. But as a service provider, how does that perception or that sentiment affect you and what you're doing in your locations?
Yeah, there's massive problems with the perception of homelessness versus the reality of homelessness. And those are two different things. And for a long time, not just in Spokane, but everywhere around the country, there was a lot of policy decisions made off of perception rather than actual data on what works and what doesn't, and how those things should work together. And so it does impact the work that we do as providers pretty extensively in the work that we have to do. And I think some of the things that Commissioner mentioned are really important in this bigger picture of, we think of homelessness downtown, but that's not where homelessness starts. That's where homelessness ends. Homelessness starts sometimes at birth. We had 30 newborns in our shelters this past year. It starts in elementary schools. It continues a cycle if you don't interrupt that cycle and provide housing interventions early on, and then we see long-term impacts of those things. And so I think the perception issue is a big issue that we need to address in our community as a whole, and realize this isn't just a downtown thing. This is every part of our community has struggles with this, just some are more visible than others. And it's a really important thing that we address as a community as a whole.
Thank you. We do know work is happening, as you're hearing the panel talk about today, and we're going to talk a lot about that. As a matter of fact, just a few weeks ago, the city announced a new comprehensive homelessness strategy. It includes 3 initiatives. The first is called Home Starts Here, which focuses on 4 pillars: healthcare, outreach and navigation, multidisciplinary engagement, and economic security. The goal is to address the multiple complex factors that contribute to housing instability and homelessness. The second initiative is a new weather agreement that in part would change the requirements for shelter activation from a simple temperature measure to an index measure, taking into account things like humidity and wind chill. And the third is a proposal to consolidate the existing laws that enforce unlawful camping and public right-of-way violations into a new engagement and enforcement ordinance. All right, with that, the home in Home Starts Here is an acronym for those 4 pillars I mentioned: healthcare, outreach and navigation, multidisciplinary engagement, and economic security. There's a lot there, but Dawn, can you explain the main goal for each of those pillars and how they work together to address what we're talking about, housing instability?
Yeah, so I think we're trying to create a framework that the city can operate under, acknowledging that homelessness is a very complex topic. I think Joe alluded earlier to the fact that there's no one way or one reason that makes a family or an individual experience homelessness. We know that access to things like healthcare are critical to stabilizing somebody. We know that shifting and coordinating better amongst outreach services is going to be essential as we continue to work towards longer term success. The multidisciplinary piece, I think, is attempting to really acknowledge that there is a role for code enforcement and first responders to play. You've seen in the last year some expansions and reinvestments in the CARES program, the BRU, the BHU, a lot of our co-responder teams to public safety. We know that they play a part in the solution as well. And on the economic side, we know that Spokane's average median income has to increase. We need to have better paying jobs so that families can't afford the rising costs of rent. And we know that it takes addressing all 4 of those components to really be successful in stabilizing somebody. Unfortunately, this is a very complicated problem, and if we don't attack it from all angles, we're not going to see long-term success. And creating a framework for the city to operate under gives us better direction and guidance on how we utilize resources collaboratively with the county and others to really make meaningful change.
I think this new framework also includes rental assistance, eviction prevention, and apprenticeship training. How would those then be funded?
So they're already funded interventions that the City of Spokane passes funds from the state and federal government to support. So we do fund those things currently. I think, one opportunity that this kind of discussion today will provide is for us to highlight a lot of the work that most of the community is not aware about because they're focused again on perception versus a lot of the work happening. So we spend a substantial amount of money every month on eviction prevention, which gets to Joe's point earlier of actually getting upstream on the challenge. Our diversion programs are quite successful in diverting people away from homelessness through landlord-tenant relationships and a lot of mitigation and damages when necessary. So I think those are all funded things currently that we're trying to really draw attention to and make sure people understand that's also part of this response.
We've heard this word already, the chronically homeless. Councilmember Dillon, this is for you. People say we don't do enough to get those chronically homeless, those people we're seeing downtown or what have you, off the streets. Again, this is going back to that broader question of informing the public of what do you tell to people who say we're just not doing enough? We've got this framework in place now. What does this all mean?
Yeah, I think it's important to really make sure that we're both talking not just about response, but also prevention. And for the folks that are that one rent payment away, they are their car breaking down. They're that one place away from being unhoused. And I think that when we look at, again, the data, we're looking at if we change how we talk about homelessness too, because how we talk about homelessness so much matters. It's not just people experiencing homelessness, it's people who can't afford rent. And so a lot of these interventions, eviction prevention funds, rental assistance really are an important lifeline to making sure that there is not, we're not crossing that step. And so really I think part of the home strategy is how we pull all these elements together. We educate and inform the public, and also make sure that people know that they're able to access these resources, and they can really be the difference between being unhoused versus not.
We'll talk a lot more about this topic throughout this show, but the new strategy that has been talked about, it's been widely covered in the media. At the beginning of Mayor Brown's administration last year, the city launched a new scattered site model for sheltering, also called specialized sites. Dawn, this first question is for you on that matter. Is it still part of the overall strategy and it works into this new framework we're talking about with these new initiatives?
Absolutely, yeah, they're complementary. I think the idea around scattered sites was always to provide kind of tailored care in smaller settings to create better outcomes. Again, it was a counterpart to congregate shelter, not a dismissal of the important work congregate shelter also provides. But I think the home strategy is inclusive of that, and how we really create tailored services that still address really deep outreach and navigation in the community, connections to healthcare providers coming on site. It's all embedded in that same strategy.
Was it something you borrowed from something you saw someplace else? Where did this idea come from?
For the scattered sites?
Yes.
I think we did some initial research. When Mayor Brown started, one of the recommendations from the transition committee was to do kind of a shelter audit. And we brought a staff member on board who did some of that work, did a lot of public engagement, presented those findings to council, I believe to the BOCC and others. And some of the recommendation in there was to consider smaller site shelters. That was a lot of provider feedback and acknowledging the importance of relationship to create change and how hard that can be to do in a large setting. So there was, a lot of public engagement, and there also are other communities who do scattered site shelters. Each community kind of has its own flavor, but I think we feel really confident about where we are today with that model and what we can continue to accomplish going forward. So a little bit of both, a little bit of community feedback and a little bit of research on what's working in other places.
Dawn, this question is also for you, but maybe Joe wants to jump in on this one. A lot of people would say, oh, not in my neighborhood. I don't want one of those in my neighborhood, but kind of explain, the benefits of having these smaller, more specialized places within the neighborhood, and people are quietly coming and going, right?
Yeah,
Yeah.
I'd love to talk about that
Yeah.
one. Yeah, so Family Promise, we piloted this initiative on accident. I mean, it was an outgrowth of, in a response to COVID, where we had some shelters that were operating out of churches that the churches closed, and what do we do? And so we moved to this smaller neighborhood site model, and we saw incredible outcomes from that. We saw 95% of our families leaving to permanent housing out of those smaller sites with no negative neighborhood impacts. Most of the neighborhoods, actually, we haven't had a complaint at our scattered sites, and we've run 5 over the past 5 years. In 3 years, we haven't heard a single neighbor complaint or even a comment about them. Most of the neighbors don't even realize that house is there in their neighborhood. And you can see, even with the statistics from just the change in the city model, third quarter of last year, where the congregate shelters were more dominant, to this quarter where the scattered sites, the exits to permanent out of our emergency shelters, third quarter last year was 9%. It's now 21%. So there's a movement towards these smaller sites in actually getting results on ending homelessness, rather than just the let's make the suffering less, to actually let's end the suffering and move from homelessness to housed. And this is one component of that. There's a whole lot that goes into that, but I think the smaller site models work well. But there's a lot of fear when you hear homeless and you hear your neighborhood. That's the truth. So,
I'll just add to that. So I had a scatter site about a block from my house. I know someone out there is going to say, well, Councilmember Dillon, how would you like, this near your house? Well, it was fine. The folks that were running it went door to door. They talked with neighbors. And I think having that transparent, open communication was really helpful. Look, this isn't scary. Come on in. Having an open house was really beneficial and helped build trust. And also, I think, to Dawn's point, the evidence-based approach around scatter sites, more cost-effective rather than the larger congregate shelters, not as many issues associated, but also being able to navigate people to services and housing and do referrals and really think more kind of upstream. So I see it as a win-win. And then to some of the neighborhood concerns, part of the package is the good neighbor agreement, looking at public siting, making sure that it is equitable and there is good open communication between neighborhoods, neighborhood councils. The city's really been going that direction with a few of our sites, and we've seen really positive results.
Councilmember Bingle, what are you hearing from your voters, and what do you think about this idea? Scatter sites?
In the scattered sites, it's important to understand, first off, I am very proud of Joe and Family Promise. They do fantastic work, glad that they're in my district. But there is a big difference between a family scattered site shelter and a specialized facility that's dealing with folks with severe mental illness or severe substance use disorder. And so I think that that's part of the conversation that we have to have, where it's families who have motivations to be working to get their kids out of homelessness is different than a young man struggling with substance use disorder, or a young man who has severe schizophrenia or something like that. There are differences in these shelters, and I think we sort of talk about them as if they're all the same, as if the impact is the same. Not that their use is the same, but their impact is different depending on the population that's being served, and I think that that's an important part of the conversation. And in my district, the district I represent, there was a facility that was going to go into one of my neighborhoods, right into the Chief Gary Park neighborhood. Now, Chief Gary Park is a neighborhood of 6,000 people, and they already have five organizations doing work in that one neighborhood, and then we were going to put another addiction service in there. And so the people that I represent are typically like, we're happy to share the burden, but we don't want to bear the burden. And that's what I hope comes out of this, is that, and it's not because my district matters any less or anything like that, it's just that in my district we have lesser property values, and so they tend to be more affordable for folks who are doing this sort of work. And so what I'm hoping comes out of this is that it does become a citywide burden rather than something that has been more pushed into areas that I represent.
All right.
I will just add to that too. I think hearing that feedback from council clear at the beginning, we do the district with the most scattered sites is District 3. So we are working intentionally with those operators to find locations to try and make sure that is spread out, because we do value that feedback and understand that impact.
All right. One of those specialized shelter sites is the Navigation Center. We visited to get a look inside at the work being done there.
I came here not knowing what I was going to do or where I was going in life.
Hope for the unhoused population, tucked away in an unassuming location. This shelter, located just west of downtown Spokane on the edge of Brown's Addition, offers more than just a place to sleep.
When people are coming in, they're engaging in services, we're assessing their needs, we're helping them triage into detox or inpatient if they need that, and then we're also looking at beds that would best fit them, and then when they get there, they can stabilize there, they can have the supports and wraparound services that they need there.
Wraparound services are at the center of the City of Spokane's new shelter strategy. Last October, the city closed the large Trent Resource and Assistance Center, also called TRAC, and shifted gears to a new scattered site model. Instead of focusing on one large shelter location, the city has been opening several smaller, specialized shelters. Lane Pavey is the executive director of Revive Counseling Spokane, the service provider for one of those shelters, the Navigation Center.
The big shelters overwhelm neighborhoods, and people do not feel safe coming into them. When they are just a number in a bed in a short-staffed place, you're gonna get assaulted in the middle of the night. You're gonna get robbed. There's no way to manage the population when you have that many people in a congregate shelter. These smaller shelters are just engaging people in a more personalized way. We're building community. People build trust amongst each other. They can sleep at night, and we all know them by name. This is what really it takes to get people moving forward and believing in themselves and creating that access to opportunity in the community.
The center's personalized support is having an impact on the clients.
I just came over here on a whim, and the amazing folks here let me come in and made me feel at home, and until I got my bed date in inpatient, and then went inpatient, and I've since gotten into clean and sober housing, and I got a job today, and I'm able to be a person, I feel like, again.
On top of 3 meals a day and a safe place to sleep, the Navigation Center provides housing and employment support and helps clients attain detox, inpatient addiction treatment, or medical aid when needed. Clients are also encouraged to join educational workshops, peer support groups, and more.
I can't explain how much help they have helped me since I've been here, as well as not even like with bus rides every now and then, or take their time out of their day to take us to an appointment to get my ID, stuff like that.
I've never felt so welcome. From the day we came here for our interview, there hasn't been a single person that hasn't come up and said, welcome, do you need anything? So it's great. This is a good program.
Housing support is the top priority. The Navigation Center has 3 dedicated housing specialists working with clients and housing partners. Since October, the staff has helped 33 clients find permanent housing and 8 find transitional housing.
And that speaks volumes to the relationships that we have with our landlords, who actually want our clients in their housing, because they know when they come with a Revive housing specialist, they have a liaison, they have someone who's going to support that person if they have some period of instability, if they're behind in rent, they know they can call someone.
The goal is to move clients into housing in 90 days. And while the nature of this work doesn't always fit neatly into a tracking spreadsheet, Pavey says the compassionate case managers and support staff don't give up, offering a lot of help with what little space and resources they have.
This is a bright, shiny place when people come in and when our staff is engaged in all of this, that we're like, there's hope. Good things are actually happening. All of us service providers in homelessness services need a reminder of that all the time, every day.
Don't be scared to ask for help.
If you don't want to be homeless, there's a way out.
I mean, I get it because I've been there, and it's a hard decision to make, but once you make that decision, there's help. And this place is definitely a rock to start on.
I think the word that stood out there was hope. I mean, we heard that said a lot of times in that piece. Dawn, your reaction to that? I mean, this scattered site model has just been into effect, 6 months or a little over 6 months. What's your response to seeing that piece?
I think, I've been in this field 20 years, not unlike Joe, and this is the world that we know. So I think, it's not surprising to me to hear that. I think when you're on the service provider end, this is the real story of how homelessness is being addressed in Spokane. This is what it looks like when people are given resources and safe places to be to get help. So it's, of course, it's like the best thing you can possibly imagine for people who have been on the streets to be in these safe places. And then, several of those clients had former, resident here. They've exited, they've been housed. That is the goal. And I think that's why we're in this work. I didn't stumble into this field, I care deeply about these issues. We know what we're doing. We're building out great programming with incredible partners. And for the service providers in this space, day in, day out, this is why we come back. This is why we're here every day working hard to make sure that more and more people have access to those programs. So it's the best news you can get.
Joe, your response to that?
Absolutely. I think the key thing there is the relationship side. We talk about the homeless and we have this big broad brush, but these are people. Like, those people have names. It reminds me of a story of when I was first opened one of the shelters here. There was a little girl who was just learning how to write her name in the shelter, and we got the family into housing. She had never been housed, and she's in kindergarten, so she's 5 at this time. And she comes in to give me a thank you card, and the thank you note when they were going into housing, it was just a sticky note, and it just said, Julia, 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 because she only knew how to write her name. She wanted to say more, but that's all she knew how to write. And it reminds me of 2 things. One, every number that we put up there, every statistic, that's a person, and that person has a name. And then the second thing, for the population that I serve, particularly the children, like, they don't have a voice, and so they can't say what they want to say. And so it's up to all of us, and a lot of the homeless don't have a voice in our community. Like, they're not in this room right now. And so we have to be the voice for them, and really provide the services that they need, not the things that we think that they need, but what they actually need. So.
All right. The Navigation Center is open 24/7. I know one of the challenges right now is having more places that have daytime hours, because oftentimes the unhoused, if they're in a shelter at night, then they're back on the streets during the day until they go back in the evening. What's the work being done, Dawn, to kind of increase that dayside look for those wraparound services?
Yeah, so we're in constant internal discussions about how do we add daytime navigation capacity, whether it's scattered sites or maybe even opening a center that's just dayside navigation where people aren't sleeping on site, but they can come access services during the day to get into the pipelines to access those shelter beds or other services. So we know there's a need there. We're working hard to try and address that, in particular for men, right? Women's Hearth is open for women during the day. Our youth shelters are open during the day for youth. Obviously, Joe's got his programming for families, where if a family can't be at school for the day, they've got a place to be. So that the main population that we're focusing on there is men, who is the primary population that does not have a daytime space all the time right now.
Transitioning into the area of cost. It sounds like, and from the numbers we've seen, that this scattered site model is way more cost effective than one larger or a couple larger type shelters. Speak to that a little bit and what that looks like funding wise.
Yeah, so I think part of what is really critical here is the church partnerships in particular that have been established. We've got incredible partnerships that have been out with faith-based leaders who have raised their hands and said, we want to provide space for these services, and not, we want to be paid rent, but not astronomical charges. And that is a huge way for us to maintain lower overhead costs for our operators. We also know that when you've got a staffing ratio of, 20 clients to 5 or 6 staff at a time, our ability to exit people is far greater. And it's that turnover that allows us to serve more people at a cheaper cost, that scalability, right? If we've got 100 people in a large facility that we're paying extreme overhead costs on, and we don't have the money then to staff it appropriately, not only are we paying a lot in overhead, we're also not getting a lot of outcomes. because there's not that relationship building that needs to happen. So it's partnerships for sure with faith-based communities and other centers that have opened their doors to us. And then it's really intentional staffing to say we have to prioritize the services people need over other expenses and be really resourceful. We get very, very limited dollars in this field. I think there's some confusion. People see the large budget number that my division has to operate with. 95% of that is state and federal money that comes with its own set of regulations and rules and expectations. There's very limited local flexible funds, and so we have to be very strategic. And I think one thing we're very proud of in the last 15 months is how intentional we've been about which dollar goes where, to make sure that we can really maximize its impact and ensure that we're getting as many services to as many people. But the big thing is reducing overhead and maximizing outcomes so that we can serve more people with fewer dollars.
Is there a number of scattered sites that the city wants to get to? I think we're at, is it 8 right now?
We're at 8 right now, and
Okay.
that was the original goal. I think we feel really good about being at 8 sites currently. We know there's additional services that need to come online. I think one thing we're getting really intentional about, and I think Joe mentioned this earlier, is focusing on the data we have. So we just put out our longitudinal systems analysis, which is a HUD required report. That data is very clear that our best way to invest resources is in transitional housing, rapid rehousing plus TH, and interventions kind of one step past emergency shelter. And so we need housing stock, right? So I think we're being really intentional now of how do we build pipelines for folks to exit shelter so that those shelter beds reopen for the next person in line. Simply adding shelter beds will not solve this crisis. We have to have a place for people in shelter to go to next. And so maintaining what we have is critical, finding daytime navigation is critical, but we also know we really need to make investments in those next steps for folks so that we can house them successfully, keep them housed, and then somebody coming onto the street has a shelter bed available.
And that's affordable housing that we're talking about, right?
It is. It's
in
affordable.
some form or another.
Yes, yeah, it's a variety of styles of affordable housing that we know we have a critical need for in Spokane if we're going to get ahead of homelessness.
All right.
Could I jump in just to
Absolutely.
say a few things? I just have been really impressed with all the work it took to take the large congregate shelter on Trent and then go to this scattered site model. It's been a lot of hard work, and I visited at least four of the 8 shelters. And I really believe that this model works. Well, you can look at the data that you just talked about. It's transitioning people to housing more successfully, faster. And so I know that the county appreciated getting that new data report that you just referred to. And we, using that information, we have been looking at how we reallocate and prioritize different types of housing for our federal and state dollars that flow through the county. And we're working really collaboratively with the city on this. And we chose to put more into transitional housing, or we were considering that this year compared to the past because of that data. So we're getting better data too. And I want to just highlight that. Joe's operation at Family Promise uses data like no other organization I've seen, because that tells you if you're actually making a difference, if you're actually housing people, and for what cost. And so that will help you make better decisions. So the data coming out of the city is now helping all of us, and we're all putting in that data, right? Different providers are putting in the data, so the quality is getting higher, and we're being able to understand better just in the last year which strategies are working better than others. So that's just really critical. And the scattered site model, the other reason I really like it is it allows for the civic and religious community and church communities and regular people and volunteers to get involved in the solution.
Yeah, it's been a really amazing.
We're never going to solve these issues without the whole community coming together. And that means the public sector, the private sector, church communities, everyone rolling up their sleeves together. That lowers the cost so that you can serve more people.
Good information there. We're going to talk a little bit more about that as it relates to the success. We're talking about making Spokane a success story. One of the towns, and I know not everybody's in agreement with this, but one of the towns that's heavily talked about as having success as it relates to the homeless situation is Houston, Texas. Their Coalition for Homeless reports more than 60% decrease in homelessness since 2011. That program focuses on providing the wraparound services, but specifically housing. That's the big one, as you guys are sitting here talking about affordable housing. Gavin, you traveled to Houston as part of Spokane's low-income Income Housing Consortium, Housing and Help. It was a video series. What do you think Spokane could take from what you saw?
I think some of the things that are being echoed here, I think Commissioner Waldrop talked about collaboration, and the three-term mayor there, Anise Parker, that presided over that dramatic turnaround. They have the lowest homelessness rate in the nation, about 89% lower than Spokane's when I last measured, and that's the broader homeless population. Those remarkable outcomes, and she said at some point, they're almost being overwhelmed by people like myself. The mayor at that time in Spokane came down with her contingency, New York, Boston, California, the cities in California, everybody headed for Houston because we kind of look for best practices. And so everybody headed down there. And she said, invariably, they leave disappointed because they're looking for some secret sauce. And she said, ultimately, we found a way to collaborate. And collaboration is so important, as the commissioner just said. But it's a different kind of collaboration. In her case, and she was a very hard-hitting mayor for 3 terms, it was collaboration with defined outcomes, a real steely edge to the outcomes she insisted on. So it wasn't just getting together, talking about, it was having an agreed-upon strategic plan and very specific outcomes that you could measure to and timelines associated with those outcomes. And so, when we were talking about the ordinances earlier, I like the ordinances. There's nothing you could disagree with the proposed ordinances, but they're aspirational in all cases. There's no, do we need to increase median household income? Absolutely. We've been talking about that for decades. How much by when? Because, if you're a business owner downtown and you're struggling and say a pipe breaks and you're opening in 4 hours, you don't say, we're gonna work on pipes. You say, we're gonna have that pipe fixed before 4, period. Because they don't have the luxury of chatting about it or, general collaboration. They have to have a defined outcome by a specific point in time. And I think, we have to hold 2 conflicting thoughts side by side where the stories we just talked about, whether it's Cannon Street Shelter, certainly, if you go visit Joe and what he's doing at Family Promise, you'll walk out feeling kind of emotional for several days because the stories are so heartfelt. And yet, you have to hold the other side of the equation with all those aspirational stories and things that are going right and all the hard work that everybody here is doing and realize that we have the top overdose death rate in America, that we have one of the top homelessness rates in America, whether it's the broader economic homelessness or whether it's the chronic homelessness with addiction and mental health issues. We have the estimates vary, but about a 30,000 home deficit. So when we talk about a deficit like that, and when we address that in an ordinance, it's important to say, we're going to address that by this much, by this date. And so I think, going back to the pulse survey, where 10% of people in our population, in our voters, these are registered voters, are feeling hopeful about Spokane's, optimistic about our future. 10%. So 90% are feeling pessimistic. And I don't think any of those 90% would disagree with any of the great things that are being described here. I think they would feel the same positive emotion and even hope that you described, Dana. But they're also having this kind of intellectual dissonance where they're saying, but if I drive through downtown, and that's the topic tonight, I'm seeing something quite altogether different. And so we have to somehow go to measurable outcomes by certain dates to get, the outcomes really matter. So again, Houston collaborated like crazy. There's no secret sauce there. We've visited them. We've had Anise Parker, their mayor, here. Mandy Chapman-Semple, who was the architect for that mayor, we had here for almost a week on commission with the Housing and Help series. And had a lot of recommendations. We worked on them for about a year, and several people here were a big part of that, including Councilman Bingle and Commissioner Waldrop. And yet, none of those things, in my mind, were ever implemented, even though we had 8 jurisdictions coming together to agree on it. Do we have joint ventures all along the way that represent great stories? Yes, but there's a big difference between individual joint ventures, whether it's a scattered site model or any other positive initiative, and broadly coming together with shared strategic outcomes by specific dates that we can all look to and understand, like, wow, in 6 months, we're going to see this percentage decrease in chronic homelessness in downtown Spokane, and we're going to do whatever it takes to get to that place, just like that restaurant owner would do for fixing the pipe by 4 o'clock when they're opening.
All right, thanks, Gavin. Commissioner, you also went to Houston. What's your takeaway Can Spokane use anything that you saw from their model?
You know, the biggest takeaway for me, and it was a great visit, and I got to meet with folks who are part of the nonprofit called Coalition for the Homeless. And what they chose to do down in Houston was to pool all their dollars through one nonprofit entity. And actually that entity already existed, and then it kind of evolved to be the main investor of the funds. But what's interesting about Houston, and what I think we need to move to here in Spokane, and I think we'll get there, and we're taking steps. And actually we just passed last night, the county commission passed an interlocal agreement. We agreed to an interlocal with the City of Spokane and the City of Spokane Valley to collaborate in better ways around our homeless dollars and our homeless strategies and our homeless plans, and reporting out outcomes to the community. So I think we're moving in the right direction. But in Houston, the nonprofit manages both millions of dollars of public funds and millions of dollars of private funds. And so, like I said before, to solve these issues in Spokane, when we have not enough housing stock today, when we have challenges with in many different areas, the public dollars alone are not going to. So that to me, that's part of. Maybe it's not a secret sauce, but there's something there where you have an opportunity to match your public and your private dollars. Get the business community involved, get our faith community involved, get individual donors involved. There's a lot of donors giving to organizations like Family Promise. The unique part of Houston's model is having all those dollars being used together to go out and double the amount that can be done in the community. So how that evolves here in Spokane, I want to see that happen. I don't want to leave any dollar on the table. So that's to me what was most interesting to my visit to Houston, was seeing the private community step up and really match the federal, state, and local dollars.
Go ahead.
Yeah, and I went to Houston with Mayor Woodward and her team, and the funding did largely come from private donors. Houston doesn't use a dollar of their general fund on homelessness, and I think that's an important distinction as well, because we in the City of Spokane, we spend $4 million out of our general fund on homelessness in a way that I don't think we should be doing that. There are things that Houston did where the people who were giving the money, basically, they weren't the only decision makers, but they had a lot of say in what was going on. And I think that's what we were trying to do for the last 2 years, is as we were building the board, as we were building the collaboration and everything like that, it was overwhelmingly not elected officials making those decisions, but it was actually folks who were participating in the work and giving the money and participating in those ways, able to drive it, because business owners and elected officials have different metrics oftentimes, right? Whereas, I'm in office maybe for 8 years, and so, something that happens in 10 years doesn't really benefit me. I need it to happen much sooner. Whereas I think business owners often are looking much more long-term and are looking for, again, the metrics and what is the return on investment. And that's what we were trying to model after Houston, which was, let's get the people who are really going to be focused on that, helping to make those decisions. And unfortunately, that fell apart. But Houston did invest a ton into housing, and that was one of the ways they were able to get out of it. And they did have good collaboration with the community. I will say, when it comes to collaboration here, one of the things that I'm often frustrated in is that, I learned about the home initiative from the press conference, right? And I learned about these homeless ordinances or this big package, 30 minutes before, that press conference. And so I think that if we're going to talk about collaboration really starts, I think, with your own body. And that's something that really needs to increase in the City of Spokane, is that when we talk about this issue, and this is something that Brienne Beggs and I thought did really well, which is like, listen, there's a lot of things that we're going to disagree on, but on this one, let's be unified in this. And I don't see that trust currently in a lot of respects, and that makes it really difficult to bring a community together when it looks like representatives from part of the community are being excluded from the conversation. It's really tough to tell people trust us and collaborate when trust isn't given.
Can I
Go ahead.
respond to that? Yeah.
Go ahead.
I think one of the first policy items I brought forth was to declare an emergency on fentanyl, and Councilmember Bingle was a co-sponsor on that. So I think we can debate around collaboration. It is happening, happens in different ways. And I think on the topic of housing in particular, we're pretty locked in. Most votes before council are 7-0. On the topic of indicators for reaching that housing, we have the land capacity analysis, which does have affordable housing indicators in that with set goals by year through 2046. But to just the point about the policies, this is a first draft, it's a first iteration, it's been heard in committee, and what Gavin just named, something that we can certainly add, and that's why I'm glad we're having this discussion. But oftentimes when ordinances are introduced, they go through a lot of different iterations and community feedback, and it is going to be a while before we actually take a vote, because part of that is having more of that critical feedback.
Can I just add one thing?
Yes.
And not on this element per se, but I think one thing we have to keep in mind, and Commissioner Waldron mentioned this, but it's not a little bit of philanthropy money that nonprofit in Houston gets, it's millions of dollars. We don't have that philanthropy in Spokane. That's not happening. So I think having that kind of flexible philanthropic money is critical to the success Houston has experienced. And so comparing that to a community where that's not a relevant bucket of funds seems kind of problematic. The other thing I would note too is that we've actually housed more people since 2012 than Houston has. So Spokane's housed over 37,000 people since 2012. That represents about 6% of our per capita. The same number that Houston has rehoused counts for about 0.45%, right? I haven't seen their backbone of their data, but if you just pull it on their website and compare it to ours, we've housed more people. We're doing great work, and our regulatory environments are incredibly different here, and the amount of money flowing in that we have flexibility to do unique programming with or develop housing with is markedly different. So collaboration, absolutely. Can we do more? Absolutely. Can we operate like Houston? We do not have the tools and the resources they have.
I would say, though, on this, that there is money on the sideline that has been set aside for when we as a region can come together with a plan. And to be fair, we definitely don't have Houston money, right? But there are good big organizations, big corporations here in the city of Spokane that are sitting on tens of millions of dollars that are waiting to invest. And so it's not as if we don't have access to that. And that was, again, as we were trying to, build an organization that all the different regions could agree to. I think that's what those people are looking forward to. And that's not to say that work isn't happening now. Dawn and many others, we just, again, we have this ILA that's coming forward that is increasing, how we're cooperating with organizations. And I think that's really good, and it's positive work that's coming out of the city, but could be better.
Yeah, I would just mention too, in the Pulse survey, like 90% of people felt like the city of Spokane had enough financial resources to deal with the issues they were highlighting. And I agree that we need more resources, but in 17 years as the city CFO and raising our credit rating from near junk status to AA during that time period, and a lot of initiatives, whether it's cleaning up the river, fixing streets, doing parks, it goes on and on what it was accomplished during those 17 years by a lot of people. But the one thing I saw throughout my time as a CFO is that a lack of financial resources was never the impediment to getting things done, never once. But what was the impediment in almost all cases when things weren't getting done was a lack of collaboration. So, if you look at the schools and libraries, the schools and parks collaboration right now, and you see when they get together, they had 30 projects that couldn't, it's kind of like this, where you end up with a lot more. And the collaboration, we do need more funding. And I agree with Don and others that and Commissioner Waldron, we need more money. But the money comes from collaboration and going across the entire, we have all these independent silos, like literally hundreds. And when you have those silos and you somehow bring them together, you realize you actually do have the capability and resources you need, but we haven't found a way to bring all those resources together.
The word collaboration brings me to actually our next discussion point, which is your crisis walks. Can you explain what those are? And it's walks you do in the early morning hours with a variety of people. Explain the purpose behind that and why you're doing it and how it's working.
Yeah, thanks, Dana. That started, we did our 86th consecutive walk at 5 a.m., 7 days a week this morning. And, it started as a metaphor, and it follows closely on what we were just talking about with collaboration, because we started with a metaphor, and I think that's kind of gotten lost why we did that. But the metaphor was, and just based on those 17 years at the city, is you have a mayor's cabinet and 13 division heads and some other additional people, and most of those are what are called exempt confidential. They don't have union representation, and they also don't have civil service. In other words, a mayor can ask them to do almost anything, as long as it's purpose-driven along our goals and objectives of the city. So the metaphor was, the mayor could tomorrow ask her cabinet to meet at 4 a.m. out in front of City Hall, and they're going to go for a walk. And having been parts of cabinets that were requested to do unusual things by different mayors, you'd be scratching your head, but you would show up at 4 a.m. and then you'd go for this walk. And maybe you do that a couple days in a row, and maybe on the third day the mayor announces, by the way, we're going to do this walk, 7 days a week, 4 a.m., until we do this walk for an hour, because each day it's an hour, and we don't see a single person suffering and dying on our streets and sidewalks. And so this gets back to the element of collaboration, because I guarantee by the second or third day, people like me, the financial guy, are going to be going up to SPD, Chief Hall in this case, who would be on that cabinet walk. And I'd say, Chief, what's this going to take to clear the sidewalks? This 4 a.m. thing isn't working for me. And he'd say, I don't have the horsepower. And so he'd be talking to the sheriff, John Knowles at the county. And then pretty soon other members of the cabinet would be talking to the city council, who can move a lot of dials. And then likewise, the sheriff would be talking to the commissioners. And pretty soon everybody's talking to everybody. You've got Spokane Regional Health District. You've literally got thousands of organizations that within about a month would be talking to one another. And I suspect you would have daily meetings, after action reports. What worked yesterday, what didn't? Where are we missing collaboration? Where is it working? And you make adjustments every single day. And my belief is that within about 3 months, you would have sobering beds springing up. You would probably have to bring the state in as a declaration of emergency to suspend regulations essential to get sobering beds up and running. The city and the county both have made some really outstanding contributions towards sobering beds, but like the scattered sites, not nearly enough. It takes about 2 years to get sobering beds online quite often because of rules and regs. But just like we see across the country, when you have a physical emergency that we're used to dealing with, like the Gray Fire, everybody comes together and you fight it intensely until that fire is out. So that's what would have to happen here. So you'd work with the governor, suspend those rules, regs, et cetera, to get you where you're going. You're working with the hospitals at that point. You're working with the private sector, because we do need those resources. You might say, where do we have vacant commercial property? Well, we've got Geiger also. Where could we put 100 or 200 sobering beds? Hospitals, we need staffing. Can you help us? Well, if we help them with what's happening in their emergency rooms, and they're really losing a lot of money right now, they would be willingly pitching in. That's how you create that private sector contribution, is through win-wins. And so that's what the walks were about. And so, they vary. They were never designed to have a lot of people. They were never, I've heard a lot of critiques, like, why aren't we serving, actually we did serve coffee and donuts yesterday, but most often we don't. And why aren't we doing that all the time? Why aren't we handing out literature? But really it's just being present to the situation, seeing what we have, and trying to research and delve into policy that can address what we're seeing. I will say one thing for sure. We've learned during these walks of 95 days, is I don't see anybody that should be in jail. I just don't see it. A couple people have commented, that was a drug dealer, and I'm looking and I go, okay. But most of the drug dealers, or when it appears to be that way, are probably feeding their own very awful addiction, and it's small scale. What I see is people with a medical condition, and that's where law enforcement comes in now. It's compassionate enforcement. That is not like what we had with the war on drugs back in the day, when addiction was treated much differently. It was treated as a crime. Now it's a medical condition, and you approach that with compassion, but you also have compassionate enforcement. If you can't go up to the individual on the street that's smoking fentanyl, which we saw this morning openly in numerous places, and we do every day. I drop off a son at Lewis and Clark every day at 8 o'clock, and when I pull away from there, I pass Shalom Ministries, and I see people openly using fentanyl a block away from LC, as many vulnerable young teenagers are going to school. But we can solve that problem, and we're going to have to solve that problem and come together to figure that out. But that's what those walks are about. And yes, we did fudge a little bit. The 4 a.m. metaphor that I started with somehow moved out to 5 a.m.
Yeah.
And then I'll finish those. I'll just mention I'm going to close out 100 days consecutive. I'll keep doing it, but I need to go visit 13 grandchildren in other parts of the country.
Oh.
And so we'll close it out at 100 days. But my last walks later this month, as we close in on 100, will be through Seattle and Tacoma and Portland and Boise, our neighboring cities, and doing it at 5 a.m. there also, just to get a baseline, because as we learned that we're the top overdose death rate in the country, or that we have one of the highest homelessness rates, it's important to compare policies and outcomes with these other neighbors of ours.
Does anybody else want to add to the crisis walks?
Well,
or have been on one?
have not been. And imagine it, I also understand the crisis, having not ever gone on a 4 a.m. walk. It's not lost on me, the urgency. I do this work all day, every day. I think if this issue was as simple as a broken pipe, we'd have solved it, right? But human problems and social problems are not like pipes. So of course a business owner would have their pipe fixed by 4 p.m. We're not going to house 100 people by 4 p.m. It's just not the way that those problems work. And we agree with the urgency. The mayor and part of her cabinet did do an urban plunge with Barry Barfield. Many on her cabinet are very immersed in this space and familiar with the work that's being done. I think there's a lot of ways that we can make really positive momentum. I think what has been shared that's simply inaccurate is that there's not that kind of collaboration happening. I don't think we need a 4 a.m. walk to convince us to talk to Multicare, to talk to Providence. We've met with both of them to talk about their emergency departments. We opened Westminster as a scattered site focused on medical respite in partnership with Providence. We've met with multiple other philanthropy organizations. We're meeting regularly with the county staff, the Spokane City Valley staff. We meet with philanthropy. We talk to the regional health district and all of our healthcare providers like Chaz, who we funded for street outreach on a regular basis. So those things are happening. And the idea that they're not, I think, is problematic for the public, because it sends a very inaccurate message about what's being done. And that has been frustrating.
Dan, I would just like to add, and I don't want to make this a debate, because I really respect what Dawn does at the city and her background and her professionalism and hard work. What the citizens are seeing is the highest overdose rate in America.
And more housed people die in overdoses than unhoused. Critical fact.
Yeah,
from SRHD.
absolutely.
So.
But in the aggregate, that's what we're seeing. We're also seeing one of the highest homelessness rates, whether it's chronic or the broader homelessness issue. And so if it's with all that hard work, it has to result in outcomes. And yes, it's remarkably more complex than a pipe, which is a simple analogy, or even my 5 a.m. walks, which is a simple analogy. But it's going to take, you have to reverse engineer off an outcome. And that outcome has to be, why isn't our homelessness rate similar to Boise's, which is over 70% lower? Why isn't it, and a much lower overdose rate? Or, and it has a similar politics. I think people tend to think Boise's a lot like North Idaho, but it's not.
They hadn't heard of fentanyl. We asked, do you have a fentanyl crisis in Boise? And they said, huh? So that's part of why.
Well,
and
it probably has a lot to do with their
They were
policies.
also very clear that they don't have I-90 or any major freeway running through their community. So we went to Boise, we met with them, we had this conversation, we met with their homeless service providers. They had very real reasons as to why it looks different. I'm not saying there's not incredible amounts of work we need to do here locally, but again, each community is not like the other. So we have a fentanyl crisis, Boise does not. We have I-90, which is a major thoroughfare.
But the
SPD
drug
can speak to
highway
that.
starts with I-5 and
does
Seattle
not go
and
through
Tacoma
Boise.
on I-5, further upstream on
And does
that
not go to
highway,
Boise.
much lower overdose death rates than Spokane, and been decreasing the last 2 years, even though Spokane's have gone up 49 and on track for another 40% increase currently. And that's not because they peaked way earlier. It's actually, we've been on a 5-year run now of dramatic increases, even as they've been decreasing throughout that entire time. So we hear about these things, but we're wondering, okay, if that's all true, why are other cities dealing with it? Or is Spokane just so uniquely situated economically and geographically and otherwise that we have this problem that's insurmountable, and all you citizens should just ignore what you're seeing with your own eyes every day as you go downtown? I don't think we should.
No one has said that.
So it's not insurmountable. About 3 weeks ago, we had a joint meeting with the mayor, city council, county commissioners, where we had a presentation from Sheriff Knowles, Chief Hall, and talked about how Spokane is a fentanyl trafficking hub.
This opioid epidemic, this overdose epidemic is costing our emergency services system a tremendous amount of money. You think what we could do if we could reduce our call load for our firefighters and our police officers fully by a third.
from Southern California up through Tri-Cities, from Montana, were it. I mean, when they discovered really, I think, the largest and only pill machine of its kind in the Western United States, it was in Spokane. And so we have to recognize that. And there's been a lot of levers we've been pulling to get a handle on this, including, which was on pause for a while, from the federal government prosecutor in the U.S. Attorney's Office to work with the city to investigate and charge traffickers to stop it at the source from it coming in. And so we do have to recognize that, yes, like, it's not insurmountable, but there is the growth of challenges here that with our growth, it's not being commensurate to, I think, a lot of what we've seen on the streets and trying to wrap our arms around that. And it feels like we're catching up, but I do think there's a lot of good things on the horizon that we are going to start to see a reverse of the trend.
All right, we're going to get back to the drug issue here in just a minute, but we want to move on for just a second. The Washington Supreme Court ruled in April that the City of Spokane's Prop 1, which banned camping near schools, parks, and child care centers, was invalid. Voters approved the measure by a wide margin in 2023. However, the court found the measure to be administrative rather than legislative, meaning it attempted to change how the existing policy is implemented rather than creating a new law. Now, this finally brings us to our chief, who's been sitting there patiently. Assistant Chief, is this new proposal that we talked about at the top of the show, is that in response to this Supreme Court decision against Prop 1, where we're trying to get a handle on the new ordinance to streamline the enforcement of unauthorized camping and right-of-way violations?
It's working through that for sure, but it was also it was investigated prior to that. So they started looking at ways. We've got so many ordinances out there that deal with the same type of crimes and same type of issues. And so we're looking at a way where we can streamline that, have those wraparound services that everybody have talked about here, how we can deal with those through engagement, and then, like Mr. Cooley said, through enforcement, compassionate enforcement, if we need to. So yes, this is in. It has to deal with that being overturned, but it's a way that the city looked at how can we streamline some of our ordinances, make it better for the officers, make it better for our citizens, better for our businesses. We look at this as a way to try to get a win-win, where we can help folks that are in crisis, help business folks who are suffering and want police to interact with people and move them out of their areas. If we can engage these folks and provide them with a wraparound services, provide outreach, that's our ultimate goal. And that is kind of what this ordinance is doing, is working through some of those issues we were having.
So it's a new tool. Is it the best tool right now in your tool chest as you come face to face with people who are unhoused out in the community?
It's hard to say our best tool. I think it's a tool. The mayor has mentioned several times that we're always going to look and adapt. If this is not the best tool, then we will adapt. We'll have to look at other ways that we can address those problems, those issues. But it's a tool that we think right now that we can now come in and provide both education, engagement, enforcement if we need to, all wrapped into one. Ultimately, what we want to see happen is not to need police. If we can get folks engaged and off that street, that sidewalk, that area, it's going to be that win-win we discussed.
What are your police officers seeing as it relates to this? With this current ordinance, the current ordinances in place, is it easier to enforce one than the other? Like, what are they seeing day to day? How are they using the ordinances and the laws we already have in place?
Yeah, there's so many of them out there that we have, and like Councilmember Dillon talked about, is this hasn't been voted on yet. So this is something they're still working through, we're working through as a city and as a county. So the problem being is one officer may utilize a pedestrian interference statute or ordinance, and another officer may use a sit and lie. They kind of deal with the same type of elements of the crime or of the situation. What we're trying to do is provide one ordinance where they know what the outcomes are going to be, what resources we have to provide the person committing either the crime or who is having a crisis that we're trying to engage with.
Talk a little bit about I think there is, and correct me if I'm wrong, but with some of the laws that are in place now, they're enforceable when you have a bed available. Is that correct? Where officers need to see if there's a shelter bed available, and if so, then we can get this person into a shelter bed. Is that part of this model that your officers are dealing with? And if so, who's the person? Is there somebody at a call center? Who's the person finding out where that bed is? How does that all work?
Yeah, currently there is. So in some of the ordinances we have, we do have to see if there's a bed space available before we can enforce or have an outcome there. And so a lot of times officers will have to reach out through our radio. We have sites that are up that we can find out pretty quick if there's bed space available. This new ordinance, not only does it take that away, but it makes it citywide. And all of us have talked about the importance, both the economic, all the importance of downtown Spokane. What this does is it opens up citywide. So if you live up in northeast Spokane, if you live up on the South Hill, you can have these, they can be seeing these same type of situations, and we'll be able to deal with it in the same way now versus just having specific laws or specific ordinances to downtown.
A lot of these crimes are misdemeanors. I think the public has a perception, well, that means, it's you're citing them and then moving on with your day, that it's not helping curb the issue. What's your response to that?
Yeah, I can't always disagree. So they are misdemeanors. Our goal in these, especially with the new ordinance, is to get them into engagement through therapeutic court, through community court. Our hope is to stop the cycle. If we can get them the medical help they need, if we can get them the psychological need, the housing need, those are the things that we got to do, because then we're not going to deal with them over and over on that revolving door. That's the ultimate goal here, is we have to look at this as an epidemic, not just in Spokane, but other places where we've got people out here struggling, and we've got to stop that. And what's the best way to do that? To engage them, to get them connected, to have those wraparound services, and see them be successful and move into housing, and then into permanent housing, because then they're not out there causing an issue for the business owner or for themselves.
The pilot core program is supposed to expand at 2nd and Division, which is a trouble spot. I think a lot of the public knows about that area as being a critical place where a lot of crime happens. Talk about, has that program been initiated, and what are the results of that?
Yeah, it has. So it's the community outreach, response, and engagement. And we need time to look at all the data. We can't just make a decision on if it's successful or not in 30 days, 60 days. We need time to look at that data, bring it in, and decide how we best utilize our resources and put our resources to affect that. So yes, we've expanded from the 2nd and Division area that you talked about. There's other areas in downtown, west downtown, that we've sent our officers to. We've kind of created almost several precincts inside of our downtown precinct where we have officers dedicated to specific areas, so they know the folks that are staying there on the streets, they know the folks who are working there, so we can connect them. That's our ultimate goal, is to make those engagements with not only the folks who are suffering, but the business owners, so that when they're suffering, we have a response, or we have connections where we can reach out to our partners with the city to get those people connected to.
The open drug use issue. We heard Gavin talk about it. We've heard a lot of people talk about it. What does this new idea, these new initiatives that haven't been passed yet, they still need to go before council, will that help you with this open drug use? Can you change that? Can we get that open drug use off the streets?
Yeah, open drug use, so that law has not changed. That is not a part of the camping ordinance. My colleagues here have talked at great length about the opioid problems and the issues, and it's so hard to compare different cities and different agencies to each other. It's hard to do the apples to apples when we're talking with Houston or with Boise, because the laws in Idaho are different than they are in Washington, and they're different in Houston. So in Houston, I've talked to several of those people. I met with Mayor Parker with a group. They had different laws where they could grab people and charge them with like a public intoxication and take them down certain areas, kind of a third site, we call it, where it's not just an ED or the emergency department or jail, but it's a site where they can either get connected to medical, to housing, to different areas, to psychological assistance. they had that option. We don't have that here. I can't just go take somebody because they appear to be intoxicated. There are things that we can do. Mr. Cooley talked about how compassionate our officers are and using that enforcement. Our guys are out there every day connecting with these folks, doing our own crisis walks every day, 24 hours a day, 7 days a week. And we are making those connections with our city partners, with consistent care, these groups where we know we have somebody who's struggling and hurting. We now have connections to bring them in, get them those services so that we can do that wraparound and then maybe take them to Joe and provide the families there. And that's ultimately the goal. And so we are seeing, we're seeing the connections being made and seeing people leaving certain areas and getting connected. And that's what our guys and our officers are doing. They're very compassionate out there as they do their jobs.
Now, in the core program, right, I don't know that we've had another update on the numbers, but its first month when it was implemented, 190 folks were engaged with, and they were offered connection to services. And of the 190, 13 took us up on that offer. So you're talking 7% of the people that we engaged with took us up on services. That's just that they connected with them. That's not that they followed through with them or they went any further. And so when we have this conversation, it's always a difficult conversation to have because when you talk about homelessness, you know, you've got 10 different definitions at HUD. You know, somebody can say it's a housing problem and they're totally right. Somebody else can say it's an addiction and mental health problem and they're also totally right. And so the difficult thing here is that it's not homelessness that people are frustrated with. It's that I think people are being asked to be incredibly patient in ways that I think is unfair to them because of the 13 who engaged, you know, Chief Hall told us that he read a study that sometimes it takes 50 or 60 times for people to be engaged before it actually takes effect. And so if you're talking 7%, right, times 50 or 60 times for them to get engaged, you're asking a community to be incredibly patient. And it's not a lack of care, it's not a lack of want, it's not a lack of patience even. It's just people are, we keep talking about perception. Perception is what people are seeing, right? So perception can't just be dismissed as if it's something that doesn't matter. It absolutely matters because they're seeing it, because it's affecting their kids, it's affecting their businesses, it's affecting their parks, it's affecting their work, it's affecting everything that they're doing. And it's the effects that are the things that people are starting to grow tired of. And so as we're going through this conversation, I don't think it's a lack of services. I don't think it's a lack of anything other than the folks that we are trying to engage with and offer opportunity to. Oftentimes that opportunity is not being taken.
All right, well, we want to take a little time to start to wrap up the discussion and talk about the impact that homelessness has on business visitation and overall economy of our city's core. Back to the GSI Pulse survey for just a second. Let's look at those topics. 89% of participants agree that a thriving downtown is critical to our region's economic health and that they are worried about the future of downtown Spokane. A smaller majority, 74% overall and 72% in the city limits, believe recent policy decisions by the city are causing local small businesses to close and move away. Now, when it comes to visiting downtown, about 60% of people say that they feel safe visiting during the day. However, you can see nearly 80% say they do not feel safe to visit at night. So what would make people visit downtown more often? A reduction in crime and homelessness top the list. Requests for better entertainment, restaurants, cleaner streets, and more parking also scored high. Well, we did speak to a couple of local business owners, and while they are passionate about being part of a vibrant downtown business community, they did offer some insight into what they have to deal with. For many small business owners, downtown is where it's at.
Well, when you think of any majorly successful business, or at least when I think of any majorly successful business, I'm so focused on the downtown of any city. It's the epicenter, right?
It's always been downtown, so we really didn't want to leave downtown.
Barbershop owner Jake Rosenberg and restaurateur Zach Tilton are both passionate about serving their customers in the heart of Spokane. For Tilton and his wife Nakia, it's also about continuing the legacy of a Spokane institution, Domini Sandwiches. Longtime owner Tom Domini retired at the end of last year, but fortunately for local sandwich lovers, the beloved lunch spot didn't stay closed for long.
My wife has always made sandwiches with Tom. She was the one person that he said that he would let carry it on. He was confident in the fact that she wouldn't change anything. The sandwiches have been made the same since the inception 60 some odd years ago. So you're gonna have in this location the same sandwich you had on a first date 56 years ago.
To keep Memory Lane open, the Tiltons first had to find a new location. When they announced they'd be opening just a couple blocks away, still downtown, it came with mixed reviews.
I mean, all you have to do is look at social media. I mean, we announced where we were moving, that we're staying downtown, and a lot of people were super excited. Oh, great, you're staying downtown, I can still come and get sandwiches. And then you get other people online like, why are you downtown? I never go downtown because of the homeless people.
Tilton knows operating a business downtown comes with added challenges. While he credits the building managers and Spokane police for keeping things clean and safe for their customers, staff do occasionally have to ask someone who is loitering to move on.
Every once in a while they'll rest on the building, but they're like, hey, you know, we're open, so you can't stay. And they're like, okay. And it's generally not a big deal.
Giving the team more time to focus on serving up their famous sandwiches, piled high with meat and cheese.
We made a promise, and that's what we're going to do, regardless of what's happening outside of our doors.
Less than a block to the north, the issues that come with homelessness are more visible outside Solitude.
Solitude means separation, right? It doesn't have to mean that you're alone. When you walk through the door, you're separated quite literally from everything else, and especially with how downtown's getting, you need to be.
A haircut, a good conversation, and a respite from the outside world is the vibe owner Jake Rosenberg is fighting to protect. But he says it's only gotten harder since he opened his barbershop in 2021.
All of a sudden, these people are like, I don't even want to be down here. I don't want anything to do with this city.
Even with the help of building management, Rosenberg says he cleans trash, drug paraphernalia, and human waste from his sidewalk daily. And while he's committed to doing his part to keep downtown clean, he acknowledges that there are some situations that are just out of his control.
There's like 10 people hanging out, they're laughing, drinking, smoking, doing all of their stuff. It's like 10 a.m. on a Tuesday. You're in front of my barbershop, vacationing with your drugs. I'm not gonna approach a large group. We don't have the bandwidth to walk up to a group of 7 or 8 people.
Rosenberg says he has noticed and appreciates an increased police presence on his block. He also recently took another step to protect his business and clients, installing a security gate to block overnight camping in his doorway.
I put my heart and soul into this place. A lot of money, blood, sweat, and tears. So I don't want to leave. But everything in life is change. And if my hand is forced where I have to change, if things don't get better soon, I don't think anybody, even as passionate as I am, needs to put up with what's happening on this level.
All right, well, let's wrap up our discussion today with a question for each of you. We're going to pose the same question. We're going to start with Joe. What is the one action Spokane could be taking right now to get us back on track as it relates to the homeless crisis?
That's a good question. As we've been talking today, we've crossed over a lot of different areas, and homelessness is an area that touches a lot of different things. And I think one of the big things to think about is, particularly when we're talking about fentanyl in particular, that's a scourge on our whole community. It intersects with homelessness, but it's not a homelessness issue. We could rehouse all the homeless and we still have the fentanyl issue. And so those are big issues that need to be addressed. And the last 4 folks that I've known that have passed away from fentanyl overdose have all been housed folks. And so it's a big issue for our whole community, and it is something we need to address. I think as far as the homelessness issue goes, I think the entire community needs to come together and say, once and for all, like, housing's a human right, and so what are we going to do to make that happen? We have to decide if it is a human right or not, and if we want that for our community. And if we want that for a community, then the whole community needs to come together. We need to build way more housing. We need to reduce the amount of restrictions on building so that we can get stuff done, which the city's been making progress for that, but it's still trying to get through planning. I mean, I had 6 projects this year. 5 of them are still going on because it's hard to get through planning on anything still. And so I think as far as what can the normal citizen do, 1, be engaged in this issue. Be engaged, get to know folks that are experiencing homelessness, that have experienced homelessness, listen to what they say, and then make a difference, do an action. And you know, I commend everybody here that is taking steps towards that, but we need the entire community. It's not something you can sit on the outside and just, you know, make a social media post about. It is something that you have to get involved in, and our whole community needs to be involved in to solve this issue.
Dawn, same question. What's one thing we could do right now to get us back on track?
The one thing part is hard. We've talked about so many topics today, and they're also interrelated. I think to Joe's point, I think, you know, we have to build affordable housing at a much faster rate. We have to have people willing to invest in that space, both private and public. We're not going to get out of the homelessness piece itself if we do not have housing available that our residents can afford. And right now, that's a very real challenge. So I think on top of all of the collaboration and things we talked about today, we have to make very large strategic investments in housing.
So get involved, affordable housing. Councilman, what do you think?
Not going to reinvent the wheel here. I think increasing our housing supply is so key, really moving from the sort of scarcity mindset that we have to abundance, and looking at the corollary relationship between housing supply, affordability, and homelessness. But to the point of engagement, I just want to thank everyone here. This has been a really thoughtful discussion. I hope it was informative for people watching, and the reality is the truth needs champions. So I hope people out there can be champions for truth.
Chief, what do you think?
I would say for the law enforcement piece, the executive side, that facility, that one facility where we can take somebody and take them down a path to the housed, to the medical, to the other sides that where they're struggling. If we could have that one facility where officers and people could bring in people in crisis and get them connected, provide them those wraparound services, that would be huge for Spokane.
Is that called sobering beds? Is that what we're talking about?
So, some are for sobering, some are for people who are just in crisis and not on drugs. They're just in crisis from a mental issue. And so sobering doesn't encompass all of it, but one part of it is for sure sobering.
Good information. Commissioner?
Well, I think Joe makes a good point, and that when you're just looking at homelessness and to the ideas around more housing, and I think we actually have a lot of opportunities to reutilize. We're underutilizing our housing. Even more housing in downtown Spokane. There's lots of ideas around housing. I think if there was one action I could take, though, as a county commissioner in the next 3 to 6 months, that would be to focus in on the chronically homeless who do have substance use disorders, and use our dollars in the next 3 to 6 months to double the amount of sobering beds and have more hours open for treatment, for medically assisted treatment. I think we could do that in the next 3 to 6 months, and that would help folks who are experiencing those challenges who are also unhoused, or who are experiencing addiction who are housed and who potentially could become unhoused without successful treatment. So I think that could do a lot in our community to stabilize and get folks out of crisis.
Councilmember?
I'll say, speaking specifically to downtown, and I represent downtown, and as a business owner, I understand a lot of the things that were mentioned in those videos. And business is already really hard. There's a lot of economic factors, but to not have enforcement of basic laws to keep your business safe from your windows getting broken out and things like that makes it even more difficult. That might be the thing that pushes somebody over the edge, as we saw with Chef Chad White. It was just like it's the straw that broke the camel's back. And so I think the thing that we could do specifically for downtown is the enforcement of our laws against bad actors, not people just in crisis who we need to get some help, but against the bad actors.
Gavin, wrap it up.
Yeah, I really agree with all these ideas, and I think the one thing I would think has to happen for all these things to happen is that emergency declaration. And one of the questions is this truly an emergency? And if you look at all of the deaths from the last 50 years of natural disasters in which we muster all our resources to deal with those, if you add them all up for 50 years, it doesn't add up to the number of overdose deaths in just 2 years in Spokane. If you look at the deaths nationally and you compare it to over 2 years, that adds up to the deaths in the Vietnam War, the Gulf, the 2 Iraq wars, and Afghanistan, all together, just 2 years. If you take 4 years, it's more than the deaths in World War II. I can't imagine a bigger disaster. And when you add the commerce element into it, the loss of jobs, the loss of commerce and everything else, there's just never been a disaster like this. And so with that disaster, and we declared one last February, but it's a different kind of disaster response. It's the kind where you meet every Monday. If Captain Wall and his team, if you muster every morning at, say, 5 or 6 a.m., and you have everybody in the room, and it's probably going to be 100 or 200 people representing all of our institutions, the Homelessness Response Network, all those organizations I mentioned earlier, you say, what worked yesterday? And say, Captain Wall and his team went and picked up some people, you can say, and we had nowhere to go with them. Well, you're going to have to, again, have that state declaration beside you. There's a book called Abundance, and it talks about how you make things happen overnight instead of in 4 years. And it usually happens when a bridge falls down on a major highway interchange or something like that. Instead of taking 4 years to build a bridge, you build it in a month. And that's the kind of mindset we're going to have, and we're going to have to put measurable outcomes out there with specific dates that we reverse engineer off of, so that every day when you arrive at 5 a.m. as leaders throughout our community, like everybody here, and you're looking and you're saying, wow, we've only got 2 months left to deliver on every one of these great ideas, and that sense of urgency. And when you set them up that way, it forces everybody together and you find a way. But it's going to take daily meetings, probably 7 days a week. It's just not business as usual. This morning's walk, going back to the commerce element, there's a new restaurant. We started our morning walk this morning at 4:30 for a variety of reasons instead of 5. But right then, there was a window broken on the new lobster roll restaurant between, I'm trying to remember the name of it. Somebody here probably knows, but it's between Riverside and Main on Washington. Mm-hmm. And the gentleman who owns it, small business owner, it's been vacant for a year, is there starting out this wonderful new restaurant, and he's out there sitting in his car just staring at this probably huge window. It's probably going to cost him $10,000 to repair, and he's wondering if he can turn it into insurance because his rates will skyrocket, or is he going to eat it on the bottom line? These are the things they're dealing with, so we've got to go into that emergency response to enable all these other ideas to happen.
All right, we have to leave it there. This has been an incredible conversation. Thank you to all of you for your thoughtful comments, and we know that we could talk about this for several more hours. We will hopefully circle back on some of these issues we talked about today, so thank you again. I hope those of you watching feel informed on the topic of homelessness in Spokane. Visit our website, ksps.org, to find links to the resources we discussed during today's program. You'll also find a place to submit future story ideas and feedback. Thank you for joining us for this premiere episode of At Issue. We hope to see you next time for more local voices and real conversations.